Hello and welcome to the Real News Network. I'm David Kattenburg. 2022, the COVID pandemic is now into its third year. The stats are staggering. 300 million have been infected by the coronavirus, and almost 5.5 million have died. Half of COVID deaths in just 7 countries: Peru, Mexico, Russia, India, Brazil, and top of the list, the USA, now approaching an astonishing 900,000 dead, 600,000 new cases in the USA every day. But numbers don't begin to capture the mayhem COVID-19 has caused. Isolation and quarantine, no more hugging, suffocating masks, cotton swabs up the nose, lockdowns, job layoffs, vaccine apartheid, horrid infections that never go away, swamped hospital wards. On top of it all, anger, distrust, fake news, protests, and riots. Joining me today to discuss the COVID pandemic year 3 are Frits Rosendaal and Pawel Zerka. Frits Rosendaal is a professor of clinical epidemiology at the University of Leiden in the Netherlands. He is a fellow of the Dutch Royal Academy of Science and Arts and the 2003 winner of the Spinoza Prize, the Netherlands' highest scientific award. We're also joined by Pawel Zerka. Pawel is a policy fellow at the European Council on Foreign Relations. He's been engaged with the Council's Reshape Global Europe and Unlock Europe's Majority project. Zerka holds a PhD in economics and a master's degree in international relations from the Warsaw School of Economics. He joins us from the Paris office of the European Council on Foreign Relations. Frits Rosendaal and Pawel Zerka, it is a pleasure to have you both with us today on The Real News. Frits Rosendaal, let's start with you. You're an epidemiologist. Let's talk about epidemiology for a little bit. Epidemiology is the study of the dynamics of disease transmission in populations of people. And if you read an introductory microbiology textbook, as I do, truth be told, I actually teach microbiology. But if you read an introductory microbiology textbook and you're looking at how diseases move through populations, the dynamics, we read about the general population immunity. We talk about the general health status of the population, educational status, quality of housing, access to health care, water, sanitation. We talk about cultural mores and of given societies. But it seems that now with COVID-19, there's a whole new panorama of population-wide issues that come to the fore, like politics and social media, civic alienation, right-wing podcasts, QAnon are now playing a role in the transmission of this infectious disease. So my question to you, Frits Rosendaal, is: has your own understanding of the dynamics of disease transmission through populations from an epidemiological perspective, has it widened since the advent of COVID?
Well, yes and no. So maybe it's good to first explain a bit what epidemiologists do. I think the whole phrase obviously comes from epidemics, and probably from the Spanish flu now 100 years ago. Then epidemics disappeared until recently, and epidemiologists focus more on chronic diseases and all kinds of diseases, basically, and are sort of the methodologist of medical research. I myself am a cardiovascular epidemiologist by nature, by what I do. And it's good to, when you look at epidemics, there are 3 types of people involved. They're the virologists. Those are the ones who understand the virus. They're usually not doctors. They're the infectiologists. They're doctors. They treat people who are sick. And they're the epidemiologists who study transmission, as you say. If you compare it to a war, a virologist knows everything about the Kalashnikov, can get it out and put it in again. The infectious disease doctor treats people who have been shot. and the epidemiologist is sort of the general, looks at the whole. Now your question about, so we study the transmission. Why do people get sick? Who gets sick? Who has the highest risk of getting sick? And everything you mentioned plays a role. Genetics, the virus itself, obviously, the host genetics, the environment. And the environment is everything that you mentioned: podcasts, politics, housing, poverty, everything. And some of those are quite new. Obviously, podcast and social media didn't exist 100 years ago, or 1,000 years, almost 1,000 years ago, when the Black Plague raged through Europe. But many things are the same. Civil unrest is the same. The unbelief in science is the same. Alternative medicine use increased enormously after the Spanish flu. So the societal response seems to some extent quite similar to what happened in the past. And the medical disease, well, this follows exactly the pattern of the Spanish flu. If you look at it, there are 3 waves now. This is in all likelihood the last major wave. Of course, there are differences. There was no vaccination, there was no treatment, there was nothing in the past. But many things are similar to my feeling.
But I mean, looking back to the Spanish flu, and perhaps more recently to the polio epidemic, and I realize polio wasn't a pandemic, but it did surge all around the world, and a couple of vaccines were introduced to treat polio, and everybody got vaccinated. I don't remember getting vaccinated myself, but I did. But I mean, was there as much a public protest and controversy over vaccines back when polio was a problem and the polio vaccine was being promoted as there is today? All this brouhaha about vaccination. Was there this much discord over vaccination back then?
I think it was much less about polio. Polio is really a disease that only started becoming epidemic in the last 100 years. It's a viral disease that comes around in summer, not in winter, and 1% of people, or 1 in 1,000 who get these horrible paralysis. And there were major epidemics in the 40s and 50s that led to quick development of a vaccine. Took a bit longer than the COVID vaccines, but quite fast. And there were 2 of them, and they've been used extensively. And if there's one success of vaccines, it's polio. It's almost disappeared. There are only 2 countries in the world where it still exists. So those vaccines took hold. In some countries like my own, there's a very orthodox religious group, which is not so small, who believes that vaccination is going against God's will, like also insurance. They don't vaccinate. So that's why we still get polio epidemics now and then. The last one was in 1992, and there might well be another one soon. We're expecting it, basically, because herd immunity goes down. But if, for instance, you look at the first vaccination, which was against smallpox, there was major opposition to that. There were authors who wrote long poems, even. There's a Dutch guy who wrote a poem why vaccination would be so bad, and everything that we see now in the opposition against COVID vaccination, we saw then too. So in a sense, there's, again, not so much new.
Pawel Zerka, you're with the European Council on Foreign Relations, and back in September, a policy brief was published by the Council, authored by Ivan Krastev and Mark Leonard. I believe you were involved in this, and it talks about Europe's invisible divides, how COVID-19 is polarizing European politics, and the report talks about in the context of the disease here in Europe, it talks about a tale of 2 pandemics. Can you talk about this?
Yes, thanks for flagging that publication. And since I'm speaking from Paris today, maybe I'll start by recalling you that the motto of the French Revolution was liberté, égalité, fraternité. And I think that what we are seeing right now is a clash between two of those three elements, at least, mainly the liberty, freedom, and fraternité, which is about social responsibility, about brotherhood. So what we are seeing right now is that different understandings of freedom are emerging, and I if I can allow myself such a reflection, of course, COVID is a thing which requires a discussion about most urgent things, treating those who are infected, providing people with vaccines, etc. But if we have this discussion to allow ourselves a more long-term perspective on those things, then I believe that this is the moment when the understanding of freedom is coined anew, and this is also where a divide is being emerging between those who understand liberty in a more libertarian way, as something individual and something that you cannot accept compromises on, whereas others understand also this liberty as related with social responsibility, and therefore requiring some compromises sometimes, such as about getting vaccinated or staying at home in order to not to infect others, or wearing masks. So in the report that you mentioned, we draw attention on several divides that are emerging in European societies, which we analyzed. But I think that this divide, from my perspective, is the most important one. We are living at a moment when the understanding of liberty will be developed for the next decades, but probably we will not develop the same understanding for entire populations, because what we can see right now is that there are parts of the populations which have grown very used to an individualistic understanding of liberty, and who therefore cannot accept that the state requires them to wear masks, get vaccinated, or stay at home.
So, getting a little bit more concrete, Pawel, it seems that COVID has affected Northern and Western Europe to a different extent than it has Southern and Eastern Europe, with the latter suffering more. And just looking at Worldometer the other day, I see that ranked by deaths per million, 15 out of the top 20 countries in terms of deaths per million are in Eastern Europe, the Balkans, and the former USSR. So it seems that, just really concretely, Eastern and Southern Europe have suffered more from COVID than have Northern and Western Europe. Can you talk about this?
Yeah, of course, this picture keeps changing as the pandemic develops. At the beginning of the COVID-19 story, it looked like it was mostly something suffered by Southern Europe, and whereas the Central and Eastern Europeans felt like they have managed the crisis quite well. This was the picture in 2020. But then when vaccination came, it turned out that many of those countries, including the one that I'm coming from, Poland, did not deal with the vaccination campaign as well as countries in the West and in the North. Sometimes pure politics had to do with it. So, for example, in Poland, the current government is not very courageous trying to convince people to get vaccinated, because it knows that the part of the electorate which is hesitant is largely their potential electorate. And this is a pity. I think in many of those countries, so apart from Poland, also other countries of Central and Eastern Europe and farther east, there used to be those anti-vaccination groups used to be influential over the past decade already, but it concerned different sorts of vaccination, so mostly towards children, because that was the discussion before COVID. And also these are societies where trust towards the governments can be much weaker than in the north or in the west. And it turns out that levels of trust matter when you have to introduce difficult measures, which would naturally provoke controversies, because as we discussed earlier, when there is a measure to forcing people to stay at home or to wear masks or to get vaccinated, whether it's compulsory or whether it's semi-compulsory, like with the COVID pass, which in the French context means that you cannot get into a restaurant or to a museum without having gotten vaccinated. So the state is not forcing you to get vaccinated, but informally it is. So with such measures, you will inevitably provoke a resistance of a part of a society, because democratic countries are not used to so compulsory measures, which seem to clash with the liberty which democracies were supposed to defend. But as I was saying earlier, we are living in a moment when that understanding of liberty or freedom is getting redefined. If you allow me one final comment to put it in a balanced picture. So we talk a lot about people protesting in different countries against the various restrictions. But we should not forget that the broader picture is the one of a large acceptance of those difficult measures introduced by governments. In France, 90% of the society has been vaccinated already. There are countries like Sweden where plenty of people are vaccinated, even if it was not even if the government didn't necessarily encourage people so actively to do so, even if the lockdown measures were kind of loose. So this social responsibility does not have to be forced upon societies. It can already be there as something existing in a society. And just let me quote one number. When last year, before the summer, in one of the public opinion polls that we conduct in the European Council on Foreign Relations, we asked people in 12 European countries whether the restrictions that have been introduced by the governments were too strict, just enough, or too loose. Only a quarter of respondents was saying that they were too strict, which shows that much more people were feeling that the restrictions were just right, or even expected them to be even stricter. So we should obviously talk about the misgivings of those citizens who feel uneasy about the different restrictions, but we shouldn't focus only on the loudest part of the societies.
Frits Rosendaal, tell me about the situation in the Netherlands. I mean, the Netherlands is a country renowned for its sense of liberty, individual and public, and its exceptional degree of tolerance for those who wish to follow their own path. But at the same time, it's a country where people are very much used to being civically responsible. And I live in the Netherlands now. After several months, I've got 4 different government numbers. And so there's this kind of a dichotomy in the Netherlands. So how do we see COVID playing out here in the Netherlands? Like, I remember when I arrived here in the Netherlands, towards the end of the summer, it was as if the pandemic didn't exist here in the Netherlands. I was the only person wearing a mask at the Albert Heijn. And everybody was just going around as if there wasn't any pandemic at all. And then with the rise in the incidence of cases, suddenly everybody's wearing masks. So tell me how the pandemic has unfolded in the Netherlands, given this kind of two-sided nature.
Yeah, that's I could talk about that for hours, Pawel, which I won't do. But a Belgian colleague of mine once called the Netherlands a slightly over-organized country, which I believe we are. So that explains your 4 government numbers. But it's true, we have a history of tolerance, which came out 500 years ago from civic strife over religion. Then again, we do have people have to have a driver's license to drive, and they're not allowed to drive when they're drunk and things like that. So we have laws that curb freedom, obviously. But I think what you find here is that to some extent, and I don't know exactly why that is, but I think that was communication by the government. There was this feeling now and then that it was over. That was after the first wave in the summer of 2020, and it was again this summer. Well, obviously, when certainly in 2020, when only 5% of the population has been exposed, there's no vaccine. How on earth could it be away? It's still there. So that has surprised me, and I think a lot of response is probably also psychological, that you see people going somewhat into a realistic path, to put it that way, and others to become very over optimistic and wanting it to be away, and that explains it maybe, that people want it to be away. But on average, I think exactly what Pawel said is true. So we see protests and we see the police against the protesters, but this is a small minority. 90% of people have been doubly vaccinated. People are standing in lines to get their booster. And at the same time, there's a lockdown here, but it's open in Belgium. There are hordes of people going to Belgium to shop and to go to restaurants. So there is a irrationality which I cannot grasp, but which I guess is part of human nature. So people are not always acting in their own best interest, let alone in the best interest of their companion residents of a country.
If I can just add on to this, in Poland, since the government is so timorous towards those who don't want to get vaccinated, actually, the discontent that you can see is now largely on the other side of the debate, among those people who are dismayed that government is doing so little and reacting so weakly towards people who are posing other people's in danger, contributing to the overwhelming of the hospitals, and therefore, this discontent can be located in several places, but in general, the picture is the one of broader acceptance and a minority still resisting the social responsibility element of the pandemic.
I agree
And the
completely with you,
European
Pawel.
Council.
I think if you,
I'm sorry, go ahead, Frits.
Yeah, I agree completely with you, Pawel. I think if you go back over those 2 years and do polls of the Dutch population, on television, you would see the protesters who think the measures are too strong. But I believe in a poll, probably many people would have said that the measures were too weak and that we started too late with vaccination, we started too late with the booster. The lockdowns weren't strict enough. We didn't have face masks too very late in the pandemic because the advice of the government didn't believe in it. And of course, their effect is overestimated, but still they might do something. So I believe we have a bit of a skewed view because we see the loudest people.
And the European Council report, Pawel, points out that the most affected, the most disenchanted seem to be the younger generation.
Yeah, this is kind of clear, but it's always good to get a confirmation in a poll and in the results. But this has been an event, this pandemic, when for many months, when we had the strictest lockdowns, the oldest, the most vulnerable, were kind of privileged over the youngest, who were not as vulnerable. So the students had to stay at home. And there are many reports showing that psychological effects of that homeschooling might be devastating for the young generations. But they had to do so in order to limit the spread of the virus and to save the older ones, especially before the vaccines were developed. If we can have this discussion in a like a more long-term reflection on it, I wonder whether the COVID-19 will become a sort of a generational event, a formative event, in the same sort as we talk about Generation 68, which were associated with in the US anti-war protests, but elsewhere in Europe also university protests, also in Czech Republic and Poland. The 68 was a year of protests of mostly young people across the world, and it contributed to the emergence of a generation for whom civic liberties were important. So I wonder what will be the generations emerging from this pandemic, and I hope that this will be a formative experience in understanding that freedom needs to have its limits in order to be really a freedom, because there is also social responsibility. But I wonder what would be the conclusions that people draw from it when it comes to their appreciation for democracy, for example. And our polls, a different thing that we found is that people understand that this is a particularly tricky challenge for the democracies. We asked people whether democracies like the US or Germany or autocracies like China or Russia are dealing better with different challenges. And for people in European countries, it's clear that democracies are better equipped to deal with climate change or to provide global security. But when we ask them who is dealing better with COVID pandemic, then people are strongly divided, almost 50-50 on that question. And there are countries in Europe, such as Italy, for example, where a clear majority is thinking that actually autocracies are dealing better with the COVID pandemic. So maybe it's partly justified because democratic governments have made many mistakes in Europe, and the fact that they need to compete in the electoral context is partly to blame. So they are looking for quick and easy successes, whereas the pandemic did not allow for that. And the Netherlands is one of the examples when the government wanted to say that it's over as quickly as possible, and then it turned out that it was not over yet. But still, I wonder what conclusions will people draw from it when it comes to their appreciation of the democracy, and I hope that the conclusions would not be that actually we need less democracy in order to be safer.
Frits Rosendaal, I'd like to put a final question to you, focusing on this notion of herd immunity. Do you see this diversity of public and civic and governmental responses, popular responses to the pandemic, which some view as being problematic, as actually contributing organically to the development of herd immunity, the different approaches that different societies in Europe and globally are taking to dealing with the pandemic?
Well, herd immunity is not something that's good. It's not something you want, because it takes a big death toll to reach it. So of course you can reach herd immunity if you let it go. If you let the epidemic go freely through your population, you'll get herd immunity at an enormous price. So we've always, all Western countries, I think, have been on the flatten the curve mode, which is to at least keep the number of cases at such a level that we can handle it in the hospitals, and that of course will postpone herd immunity, because you make people not get sick, not to be exposed to the virus. So this Omicron variant is of course different again. It's very very infectious, so that may lead to herd immunity. But then again, herd immunity is not black and white. There's also a semi herd immunity where if enough people in the population have had it, it's difficult to encounter someone who's still vulnerable. So you'll get a lowering, which maybe you now see in some countries. But many of the things, even corona meter that you're looking at, we don't really know. The counting systems are different in many countries. In Belgium, they counted suspected deaths as death by COVID. In the Netherlands, only proven COVID. So it will take years before we really can compare and see all these questions. But I'm convinced there will be a lasting influence. Even like my parents spoke about before and after the war, I speak about before and after COVID. And if you look at previous epidemics, the Spanish flu changed culture in a lasting way. It changed politics. The predecessor of the World Health Organization was started. There were censuses of health status in populations, but it also changed. It changed art. We went to much more abstract art afterwards. It changed everything. So I believe there will be a lasting influence, and well, it will be interesting to see. And I do hope with Pawel that in the political sense it will point the right way towards more democracy rather than the other way. But I'm not a born optimist about that.
Frits Rosendaal is a professor of clinical epidemiology and chair of the Department of Clinical Epidemiology at the University of Leiden in the Netherlands. Pawel Zerka is a policy fellow at the European Council on Foreign Relations. Frits and Pawel, thank you so much for joining us today.
You're welcome.
Thank you, David.
Before you go, please don't forget to subscribe to the Real News YouTube channel and head on over to therealnews.com support to become a monthly Real News sustainer. Your contributions help ensure that we keep bringing you important coverage and conversations like the one that you've listened to today. Thank you so much for watching. Take care.